Currently, men with prostatic cancer get a number of different treatments around the world, but all of them are either very expensive or cause a lot of collateral damage.
The downside of treatments is that they're associated with significant side effects, which in an aging male are a real issue. The principal one being incontinence and rectal problems, the latter being associated with radiotherapy. For 100 years, we've been treating prostate cancer without knowing where the cancer is, and therefore all our efforts have been at defining the shape of the prostate, whether it be by radiotherapy or surgery, and trying to remove it or destroy it by various means. In the last 5 years, because we've been able to see cancer for the first time in 100 years, it's 100 years since Hugh Hampton Young did the first radical prostatectomy, we can now say that the cancer is in the left peripheral zone in the mid-gland and measures 8 millimeters across and therefore is likely to be 0.5 cc's. That kind of information, which would be normal in a kidney cancer conversation, was missing from a prostate cancer conversation.
The big challenge has been to try and find a treatment that allows you to remove the prostatic cancer without damaging the organs and the tissues nearby. If you have a heat source or a radiation source or a freezing source, the destruction goes outwards, and so it goes beyond the tumour. But in NCAGE, the destruction is inwards because it's a cage that goes around the tumour and destroys only what's inside it and nothing outside. So it means that it protects all the other tissues, whereas the other treatments do exactly the opposite.
When I was diagnosed with prostate cancer, I was offered 2 procedures. One was the removal of the prostate, which as far as I'm concerned, I'm way too young for that. And then I was approached about the new procedure. Would I be prepared to go on the trial? Needles would be placed into the prostate. They would then be heated up, which would basically burn the cancer cells away. And that would be it.
The initial idea was very clear. I came up with a probe that is not a needle. It's a probe that is like a cage, and this is where the name of the probe came from, it's in cage. And this cage is a coiled probe that just wraps the tissue, the region where the tumor is, and we destroy the tissue within this cage. And this is why it works so well for confining and not destroying anything else outside. It's a very simple probe that will come through the skin and will be inserted manually like a corkscrew, and will wrap the tumoral region. The tumor will be placed inside this cage, and we'll show that after activating the probe, because we will connect the probe to a generator, and once we activate the radio frequency, this active part will be totally destroyed, but only within the limits of the coil. And then we just remove the probe the same way, and it's finished.
I suppose the 3 biggest benefits of NCAGE are firstly that it is so localized, so you only treat the tumour and nothing else. 2, that it's actually inexpensive. And thirdly, because you can guide it in live, real time, you know exactly where it is in relation to the tumour and the surrounding tissues.
My name is Hashim Ahmed. I'm a consultant urological surgeon with an academic interest in prostate cancer. So what we're doing today is something called bipolar radiofrequency ablation using the NCAGE device that can offer a really precise, accurate, low cost, low morbidity, low side effect and effective treatment to treat men with medium and low risk prostate cancer.
My name is Clement Orzik. I'm a urological surgeon and working in UCL Division of Surgery. We just finished a case for using the NCAGE technology, and I think we did very good treatment. We cover the whole area of cancer using the NCAGE technology because we were very precisely pushing the coil just behind the capsule. So I think it will be a very good treatment. And because we spare, I think, 2/3, maybe 80% of the gland.
I was expecting probably 3 to 6 months of things not being how they was, and I was prepared for that. So obviously after a week or so, for everything to be back to normal was really fantastic.
When I see them 5 days after surgery, to remove the catheter, the main complaint is the catheter, not the pain due to the surgery, which is absolutely different from other kind of surgery we can do for prostate cancer.
Once the procedure had been done and I got home, fantastic, absolutely fantastic. Once the catheter was removed, I was fine to go back to work, everything was normal, able to go to the toilets properly, no leakage whatsoever. After about a week and a half, found that I was able to get an erection, and it's been fine ever since.
I don't see any other technology today in the market that can allow the surgeon to predict exactly what will be destroyed before destroying anything.
Men value the attributes of focal treatments. So in other words, like the fact that these treatments are less invasive, like the fact that they can be done on a day-case basis, and like the fact that they are very likely to return to baseline function a week, a month, or indeed 3 months after treatment.
Prostate cancer is all over the world. It's the commonest cancer in men. So to try and get it available to all those people is a big task, and it needs a lot of support, a lot of new training centres, and that's what we need to try and generate an interest in.